Medical experts are warning that diseases like malaria could start spreading widely due to climate change. Gauteng's Tshwane region has seen an increase in the number of infections, with officials expressing concerns by the uptick in cases. We're joined by the Gauteng Health Department's Tebogo Matjokotja. Tebogo, good evening to you. I think in the past week we have spoken where you were just raising concerns about the number of malaria cases that we were reporting in the province. What has changed between then and now?
Good evening, Casey, and good evening to the viewers as well. Not much has changed, to be honest, and I hear the concern from Tshwane. We have been seeing a number of cases that, especially because we've told you on Monday, as we have alluded, that we are on our peak season. So from September up until May, we are expecting a lot or an increase in the number of cases. So the cases that have been peaked in Tshwane is not necessarily an increase, because I think it's based on the previous years. Because during COVID-19, 2020 and 2021, we did see a decline in the number of cases.
So when it comes to where the department is focusing its efforts now, what does that plan look like?
Sorry?
Hi, Tebogo. It looks like we're having a bit of a connection issue with you. I was asking you that in terms of the department and your interventions right now, where are they mostly focused?
We are focusing them on our hotspot areas. For instance, and when we look at Tshwane, we will be focusing them in Mamelodi. That's where we are seeing a lot of our cases. That's where our interventions will be. That's where you will see our health promoters doing their health talks, educating people about malaria.
Any particular reason why you think the hotspots are disaggregated in the way that they are?
We don't have any particular reasons for that, but majority of our cases, where those hotspot areas are, we have identified that majority of people who are staying there are migrants. So those are people from Malawi and Mozambicans. So that's where we are seeing most of the cases.
It looks like one of the issues then, particularly that Gauteng has to do, given the fact that we do get a lot of foot traffic into the province, but not everybody that comes here to stay. They might just be moving through. How much then are you targeting the entry points into the province? And I would also want to know the conversation that you're having with the National Health Department.
On Monday, we alluded that we, as the province, the public health, we have launched several campaigns which will run up until December. So we are targeting our port of entry, and we've started with the OR Tambo, where the bus or the train, the bus stations, as well as the taxis, and where most of our migrants they will be taking off to their country. So we are putting people and we are urging people that as they see the Department of Health personnel, please do come to our stations, and we do have the doxy tapes that we'll be giving out to our travelers.
All right, let's leave it there for tonight. Gauteng Health Department's Tebogo Matjokotja.